Over the past few years, CHIME, the healthcare CIO professional organization, has sponsored a project to help frontline clinicians manage patients with opioid use disorder. I've been proud to be part of that effort. One of the outputs of that effort is a list of tools that EMRs have available that address our opioid epidemic. We have collated key capabilities that we think should be implemented. They are available in all the major EMRs. We talk about this in a recent podcast as well. The first two empower patients to better understand the risks of using opioids. Patient discharge summaries should include opioid precautions and education when opioids are prescribed. Online resources for clinical information on opioids should be available as well. Dashboards and analytics for opioid prescribing practices help administrators and providers track prescribing patterns, see which efforts are being used, and see if those efforts result in any changes. There are several decision support tools that help clinicians order the right things when considering pain controls and opioids. Naloxone is an antidote that can save the life of someone overdosing on opioids. There are alerts that can prompt a prescriber to order naloxone if the prescriber is ordering high doses or ordering opioids in a patient who is at high risk. Sedatives like benzodiazepines can make it easier to overdose on opioids. Alerts can fire to caution providers that the patient is receiving both benzodiazepines and opioids. In the past, we would have to make multiple phone calls and get records from other health systems to determine if a patient is getting opioids from other physicians. We now have systems that give us that information directly within our EMR ordering workflow through prescription drug monitoring programs. Patients who are chronically on opioids often have agreements in place not to ask for opioids other than from the physician who is managing their chronic doses. EMRs should remind the providers to review these opioid use agreements annually. Different types of opioids have different strengths. For instance, fentanyl is about 100 times more potent than morphine. Morphine milligram equivalent calculations standardize the strength so the healthcare team knows at a glance how powerful is the dose that the patient is taking without doing cumbersome math. Order sets can bundle together best practices for opioid prescribing, including non-opioid alternatives. EMR templates help organizations create these order sets quickly. There are clinical decision support tools that can incorporate diagnoses, age, and multiple other factors to guide providers in proper prescribing of opioids and managing high-risk patients. There are also tools in EMRs that help providers get information on opioid risk and pain control. There are risk screening tools that help providers identify patients with overdose or addiction history. These can be incorporated into the EMR. Questionnaires and other tools can help track or monitor function or pain levels for patients on opioids. Our electronic systems can help collect this sort of data so we know if the patient has well-controlled pain and doesn't need opioids or if the patient needs more pain control. I mentioned it in the CHIME podcast, but it deserves repeating. As an emergency physician, in my opinion, there are few clinical situations where our use of EMRs have helped us more than in our management of opioid use disorder. These EMR tools are examples of how we in IT are not just technologists. We are part of the care team. This opioid effort is a testament to the fact that data and information can save lives. If your system does not have these tools in place, have your CIO contact your EMR vendor. You can also contact us at the website for the CHIME Opioid Action Center.